I'm Dr. Navjot Khinda, and I'm the Psychiatric Director at High Focus Centers in Paramus, New Jersey. With the uncertainties in our current world climate, it's only natural to feel stress and anxiety. Stress can manifest in the form of regression in children. While in quarantine, many parents may be noticing behavioral changes in their child. Their child, who just a few days ago was successfully dressing themselves, eating on their own, and was fully potty trained, is now refusing to do these activities, or now experiencing significant behavioral issues, possibly experiencing irritability, whining, or having frequent meltdowns. Or with older children, a teen, for example, who is for the most part cooperative, is suddenly beginning to be defiant, leaving a mess around the home, avoiding to do homework, playing video games, and watching TV all hours of the night. This can be quite frustrating for all parents. An occasional off day can be dealt with fairly easily. However, sometimes these trends can extend for many days or even weeks, as they are now. Why is this happening? Well, children are quite sensitive to changes in their environment. With school closures, a child's weekly routine has been disrupted. They are no longer amongst school peers and are now confined to their home 7 days a week. Children may now be treating quarantine as an extended weekend, often sleeping late and eating at odd hours of the day. Another change has been that parents who were once leaving for work every morning are now present and working from home. With the current economic uncertainties, financial stressors may be causing marital distress, which may be witnessed by your children. Parents may attempt to hide their anxiety or their fears from their children. However, children can sense it. Now that we know why children may be regressing, what can be done to reduce these behaviors? Well, it's very important for parents to not get angry or reactive themselves. Secondly, it's quite vital to create a structure similar to a regular school day. Keep a regular sleep schedule and reinstall regular bedtimes and nighttime routines if they have fallen off. Keep meals and snacks regimented. Check your child's diet and adjust if they are eating too much in the way of sugar or junk food. Make sure good protein and complex carbohydrates are the staples in your child's diet. It may be challenging for outdoor play during quarantine. However, try to find opportunities for physical exercise. For younger children, play is the #1 activity that will reduce stress and help the child's equilibrium return. Spend some regular time playing with your child. Let them pick the activity and participate as they direct. When you're playing, make sure to give undivided attention to your child. That means turn off your phone and give your attention to the full play. Even if you are playing for only 20 minutes, the total attention and participation will help your child feel better. The play should be creative, meaning no screens. Play with dolls, figures, blocks, board games, or whatever your child likes. Let them choose. These playtimes with your child should happen for a while until you start noticing a reduction of regressive behaviors and a return to normal. Even for hyperactive children, play does go a long way with reactivity. It stimulates dopamine in the brain and activates the pleasure centers while increasing attentiveness. This type of play also gives kids a sense of power that helps to calm helplessness that they may be experiencing during this uncertain time. Best of all, imaginary play allows children to work out emotional conflicts in disguise, so they feel relief without actually knowing what they worked out. Adults and teens have the ability to actually talk through their problems on their own. However, young children put the conflicts into play, where they get worked out at a distance. Next, parents can assist their children by helping them verbalize their feelings. Children often feel distress, however, have no idea how to express it, so they act it out, possibly in the form of temper tantrums. A parent's job will be to move their child from acting out feelings to verbalizing them. If you have a teen, just listening without any distraction, showing real interest without criticism, and spending some alone time together is invaluable. A solid connection with your teen will go a long way in helping them navigate the roller coaster they may be experiencing at this time. Next, it's also very important to create cohesion within your family. Involve your children in day-to-day tasks. For example, meal prep, household chores. If there is marital stress, make a rule with your spouse not to argue or fight in front of the children, and make sure you're both spending time with your children and with each other. If you're feeling depleted, overdone, depressed, or anxious, think about how you might get some relief. You may consider individual counseling. Individual counseling may be an option that is very helpful, and there are many telehealth resources available at this time. Also, carving out some time for yourself, if possible, changing the daily routine in some way that makes it easier for you, and trying your best to exercise if you can, and good eating, good sleeping, you know the drill. A parent that engages in good self-care will be a more effective parent. I hope you found this information to be helpful. Thank you for your time. Take care.